Mudd today at 11:30 a.m. on KAMC.
Hi everybody, I'm Bryan Mudd, a fan of South Plains politics. Here's your talking points for this week. Some have waited, but a lot of anxious owners are now open for business. But with the virus still there, could the possibility of a lawsuit be as big a liability as staying closed?
I'm Anna Warnicki in Washington. Lawmakers are scrambling to find a solution to the oversupply of oil in Texas. I'll have that story coming up.
From the studios of KAMC Television in Lubbock, your local election headquarters. This is Talking Points with Bryan Mudd.
Thanks for joining us, everybody. Also this week, the business of being open. After weeks of transitioning to curbside and delivery services, a lot of our local businesses spent the past week transitioning yet again, this time to being open for customers. But under new safety rules, of course. You feel for the workers trying to keep the lights on at work and at home, and you feel for those still staying at home, either out of fear or necessity. Those folks worried that reopening is happening too soon. Governor Abbott's order this week allowed restaurants, theaters, and retailers to reopen Friday at 25% of their building's customer capacity. And to give some extra confidence to the worried folks, city leaders have started a voluntary Lubbock Safe program to recognize store owners that do more for safety than what was listed in the governor's guidelines.
Now, this is a voluntary opportunity for our businesses, our nonprofits, our hospitals, our churches to self-certify that they are going to hold themselves to a higher standard. And it's part of our guidelines that we've worked, that LERT recommended to the council. And if they do that, then we're starting to deliver these stickers today to go on your front door. It's a way for our citizens to know that you as an organization have taken extra precaution to provide for safety of your employees and of customers, parishioners, clients, whomever it may be that will be visiting you.
The goal is to get back to the best piece of normal life that we can get to, and that the realistic timeline is probably in the fall. We want our kids back in schools. We want our businesses open. We want to be playing football. And if we trip up on this, that's going to impede where we're going to be in the fall. So that's the goal. That's to keep our eye on the ball.
But for businesses under big economic strain, is the peer pressure to jump through extra safety hoops a bigger economic burden than it needs to be right now? That's another debate. Right now, it's just nice to start digging out from under this with no huge strain on Lubbock hospitals. Amarillo, for example, touted by many for allowing more businesses to stay open, suddenly dealing with a massive jump in cases over the last 10 days. Not so here, but most seem to think that business reopening will lead to a bump in Lubbock cases. The trick is keeping our most vulnerable folks protected while protecting our economic prosperity. All right, always a pleasure to take a few minutes to say hello to Governor Greg Abbott, who joins us now from Austin. Governor, though, I got to start with a little bit of a complaint. I'm in desperate need of a haircut. My mullet from the 80s will not work in 2020. Can you talk a little bit about what went into the decision to open certain businesses but not places like hair salons and the like?
I thought you were just trying to look cool. But listen, understand that all these decisions are based upon information that we provide to our medical team. We have a medical team of 4 doctors, including a former head of the FDA, former head of U.S. Medicaid and Medicare, an infectious disease specialist in charge of tracing and tracking COVID-19. And their advice early on was that because of the close proximity that hairstylists would have to their customer, there was a concern about the transmission of COVID-19. What we are working to do is to work out strategies so that we will be able to open up hair salons as quickly as possible. We know candidly it's the highest demand that that comes into our office, and we are trying to work on strategies that could possibly even lead to an announcement next week.
Oh, we'll look forward to that for sure. What about enforcement of some of the situations we have in the businesses that are open as far as the number of people allowed in those buildings? Is that up to local folks to take care of that, kind of like always?
It's part local, part state. Understand, like at a restaurant that has now 25% capacity, they've always had some level of seating capacity, and typically that would either be up to local officials or to the state regulatory agency to be in charge of enforcing that. The same remains true right now.
What will be some of the trends now from a case standpoint or a business enforcement standpoint that you'll watch for between now and May 18th, when I know you'd like to go to phase 2 of this?
I'll tell you about a couple of the major trends that we look at, and these are trends that the national doctors and experts on this talk about. It's not the number of people who test positive, because we are increasing the number of tests that we administer, and when you do that, you will see more positive tests be provided. What you really want to look at is the percentage of the tests that are administered that turn out to be positive. The good news is for that, the trend lines continue to go very well. So you know, nationally, about 17% of those who are tested test positive right now. In Texas, that number is far lower. Today's number is just over 5% of those who were tested today tested positive. And that trend line is down from about twice that much earlier in the middle part of April. And so the trend lines for those testing positive is good. The other thing that we look at is the hospitalization rate. We want to make sure that our medical facilities, our hospitals are not overcrowded with people who have COVID-19. We have a plentiful supply of hospitals and hospital rooms and ICU units and ventilators available to us right now.
We're thankful that we've been able to stay out of those sort of desperate situations in hospitals here in this area. Texas Tech and other state universities have said they plan to resume at least some in-person teaching this fall. Do you support that, and do you anticipate public schools being back in classrooms this August?
So I do support our universities having classes again, opening up dorms, and of course the hope of all of us is that the trend lines continue, and that maybe there will be some medicines available as early as August or September that will help be able to treat those who test positive for COVID-19. The same thing applies with regard to our public schools. We've been working with the TEA Commissioner Mike Morath, working on strategies that would allow us to once again be able to open public schools in August. And so we will be preparing along those timelines, but it's way too early to forecast whether or not any of those schools would be able to open, because we don't know yet what the COVID-19 situation will look like in Texas at that time.
We're seeing a little bit of a spike in cases in some of our rural areas. Can you speak to the support available to some of those folks? Because sometimes doctors in smaller towns are just hard to come by.
Right, and you may or may not be referring to what's happening north of Lubbock, sure, in Moore County and some other counties like that, where there's some unique challenges that they are dealing with. And there's some other more rural areas of the state of Texas where there may be some spikes. And so we do several things. One is we have these special strike forces that we use, that we send from Austin, Texas, to help these locals be able to deal with the sudden spike, so that we can administer more testing, administer certain strategies that will reduce the spread of the coronavirus, but also to address what you were talking about, and that's to make sure that the folks in these local communities will have access to the healthcare facilities that they need. So this is something that we truly remain on top of.
So important. And in the final seconds we have here, are you thinking yet about plans beyond phase 2? What comes after that in Texas?
Well, phase 2, if everything goes well, would happen around May the 18th or so. And the goal is to see how phase 2 goes in. And if phase 2 goes into effect and we're able to continue to contain the spread of the coronavirus, we will then be able to start considering these large gatherings. It could be like at baseball stadiums or football stadiums and things like that. But let's not get ahead of ourselves. Let's make sure we do a good job at phase 1, do a good job at phase 2, and people must continue the process of wearing face masks, reducing the spread of the coronavirus. Understand this, the coronavirus has not gone away. It still exists in Texas. As a result, everybody must continue these safe distancing practices to make sure we don't increase the spread of the coronavirus.
We'll sure do it, and we want to thank you for your time, and thank you for all your hard work down in Austin. Governor Greg Abbott. We'll talk to you soon.
Look forward to it. Take care.
And straight ahead, the subtle importance of